I wonder if you could help me. I've just had a health report done at work. We have to have them every year. I'm not sure what the results mean, except that I have to take some cholesterol tablets now.
Can you tell me a little bit about what your health report said about your blood pressure and cholesterol level?
I didn't understand all of it, but it says my cholesterol level is too high, and so is my blood pressure. I have to see my doctor this afternoon about some tablets, but I don't know much about them. I don't really know why getting my cholesterol down is important.
That's okay, I can explain it to you. Doctors become concerned if you have high cholesterol levels, as well as some other risk factors, especially if you are in a high risk group for heart attack or stroke.
Oh, I see why everyone is worried now. How do I know if I'm in a high risk group?
If any of your family members have heart disease or have had a stroke, you may be in a high risk group.
Well, my father had a heart attack and died when I was quite young.
Okay. Family history of heart disease is one of the risk factors. Another is high blood pressure.
Oh dear, it's not looking good. Apparently, I have high blood pressure as well. At least I'm not a smoker.
Yes, that is a good thing. Smoking is another risk factor for heart attack and stroke.
So what you're saying is that if I have high blood pressure and high cholesterol, I'm going to have a heart attack?
No, I'm not saying that. What it means is that you have more of a chance of having a heart attack or stroke than someone who doesn't have these risk factors.
Oh, okay. What about the new tablets? I think they're called statins. Won't they fix the problem?
They will lower the amount of cholesterol in your body, one of the important risk factors. However, you will still have to manage the other risk factors. For example, high blood pressure and being overweight and not exercising much.
I've had trouble losing weight in the past. My wife says I have to try this time.
I know it's a hard thing to do, but it really is important. It would be beneficial to do some exercise as well.
I will definitely try to get the weight down. I'll even go out for a walk. I don't want to have a heart attack like my father. But what about these new tablets? I'm not sure that I want to take them.
The tablets you've been prescribed are called statins. Statins lower LDL or bad cholesterol and also lower triglycerides or fats. At the same time, they increase HDL or good cholesterol. They're one of a group of drugs that block cholesterol production in your liver. This reduces your risk of developing serious heart problems.
So you're saying that I should take the tablets if I want to stop myself from having a heart attack?
The tablets are only one part of the health changes you need to make. Your doctor will probably make some suggestions about managing your weight and exercising.
Right. I understand now. The other thing is that I don't know much about statins. I bet they've got lots of side effects.
Usually people who take statins don't notice any adverse effects. Sometimes, however, mild reactions occur, such as muscle pain. In a few cases, people develop liver problems, but the good news is that serious side effects are rare.
Well, maybe it's worth trying them. Is there anything else I need to know?
Yes, there are a few things you should be aware of. Some statins, for example, the short-acting type, are best taken at night before you go to bed. Longer-acting statins can be taken at any time. Instructions about what time to take the tablets will be printed on the medication box when you have the prescription filled.
Oh, okay.
Always take the tablet whole without crushing or chewing it.
Right.
Keep your tablets in a cool place. You don't need to keep them in the fridge. Keeping them in a cupboard is fine.
All right. Well, I think I can remember that.
I'll give you this patient information leaflet so you can read a bit more about your medication at home. Remember to speak to your doctor as soon as possible if you're concerned about anything.
Thanks. That'll be very helpful.